What to expect after getting vaccinated. One of the biggest concerns that people have shared with me is that they are worried that getting their COVID-19 vaccine will make them sick. We've discussed in an earlier video how the vaccines work and how you cannot get COVID-19 from the injection. If someone happens to test positive around the time they got the vaccine, they most likely were exposed before their vaccination and symptoms only started showing up by coincidence around the same time. That being said, we acknowledge that some mild side effects that are similar to those of COVID-19 have been experienced by some people right after their vaccination. This is normal and expected. To learn more about this, I will refer to the following video from the US Centers for Disease Control. Getting a COVID-19 vaccine will help keep you from getting COVID-19. After getting vaccinated, you may have some side effects which are normal signs that your body is building protection against COVID-19. Some common side effects include pain, chills, swelling, tiredness, fever, or headache. These side effects may affect daily activities and may make you feel like you have the flu, but they should go away in a few days. If you have pain or discomfort from fever, talk to your healthcare provider about taking an over-the-counter medicine such as ibuprofen or acetaminophen, more commonly known as Advil or Tylenol. Use or exercise your arm and apply a clean, cool, and wet washcloth over the area to reduce the pain and discomfort where you got the shot. Drink plenty of fluids and dress lightly if a fever is causing you discomfort. Don't forget, if you feel unwell, and certainly if you're feverish, do not go to work and call it in. In most cases, discomfort from fever or pain is normal. Call your healthcare provider if redness or tenderness increases after 24 hours. If your side effects are worrying you or they do not seem to be going away after a few days. If you experience any of these signs, call your healthcare provider right away. Difficulty breathing, swelling of face or throat, fast heartbeat, or dizziness and weakness. After you're vaccinated, remember to get a second shot if one is required. Continue to wear a mask in public. Avoid crowds and stay 6 feet away from others, and wash your hands often. Don't forget, these things haven't changed. For more information, you can reach out to this website. It is important to note that although we're referring to the CDC for the science, there may be some policy recommendations on the website that have been adopted by the United States that have not yet been adopted by Canada or the province of Ontario. If and when these do, the HA will let you know as soon as possible. You may have noticed that in this video, other serious symptoms were listed where you should notify a healthcare provider. Many of these are related to the extremely rare possibility of a severe allergic reaction that exists with any vaccination. This is why you'll be asked to wait for 15 minutes before you leave your vaccine appointment, so you can be monitored. If anything were to happen to you after your shot, it would happen in this time frame. Even if this happens, it is extremely treatable using a drug called epinephrine, also known as adrenaline, which every single vaccine clinic will have on hand with trained staff ready to provide it if needed. The purpose of this video was to share with you that yes, it is possible to experience some short-term discomfort immediately after your vaccination, but in return, you'll be better protected from the risk of getting COVID-19. Hopefully, this video was informative and useful to you. As an extra video for those who like numbers, I'll be sharing some facts and figures for some of the mild and severe symptoms reported to Public Health Ontario at the time of this video. Thank you for joining me for this week's edition of Your Vaccine Questions Answered with me, your host, Matt Wong, and until next time, stay safe.